Good afternoon. Dr. Michael Wojtanowski of the Ohio Clinic for Aesthetic and Plastic Surgery in Westlake. We're going to do a demonstration today of a non-surgical treatment for vertical lip lines around the mouth, which is a very common problem secondary to genetics, smoking, sun exposure, and sometimes aging, but we don't have aging as a case today. But anyway, so what we're going to do is Belotero we're using today. Belotero is a filler specifically designed for lip lines, and it is a nice non-surgical way. Lois has had a topical anesthetic applied about a half hour ago, so the area will be numb. And then we're going to inject each one of the tiny little lines with a little bit of Belotero, and that Belotero will efface the line, make it less deep. There will be some bruising and swelling for a couple of days, but filler looks pretty good about 3 to 4 weeks after it looks good in a couple of days, but it looks its best about 3 to 4 weeks after we inject it. And why is that? The body metabolizes it, the body starts to assimilate it into its system, and the other thing that makes filler work really nicely is the patient's own natural facial motion, talking, eating, smiling. That tends to contour and mold this material. Sort of like Play-Doh initially, and it helps mold it into place. So we're going to get started here and do this injection process. Lois, sit forward 1 second. I'm going to lay you back on the table. And just wrap your head back there. Thank you for coming in to let us do this today. How does everything feel numb? Feel pretty numb?
Pretty numb.
Good. Great. First thing we're going to do is we clean the area off with an antiseptic, which is important. And in our practice, this is a physician-controlled process. What I mean by that is the doctor decides what needs to be done in conjunction with the patient's desires, and I do my own injections. I do not hire out or have someone else do injections. I think this is the expertise of a surgeon and a physician, and I think patients are best well served when this filler is injected by someone of my type training. As a board-certified plastic surgeon, although surgery is often the gold standard, surgery is not all we do. And when we know what to do with respect to the anatomy, it really allows us to do a much better job with filler than someone who doesn't have that background or expertise.
Stand by. Say stand by.
Okay, stand by. We'll get started in just a second. Alrighty, we are ready to roll here. This material is called Belotero Balance. This is one of the many types of fillers on the market. This works very, very well because it's a thin filler. Fillers come in different densities, and this is a thin filler, and we use that for these thin little lines that are right across the top of the lip. Okay, Lois, we're going to get started here. You really shouldn't feel much because of the topical that you put in. And essentially what happens is, you can see I'm working on this line right here. What happens is the filler magically fills out the line. It effaces it, it makes it less noticeable, it makes it less deep. And filler is volume dependent. It's impossible to eradicate every tiny little skin crease. So when we do this, we concentrate on the ones that are the most noticeable, and that makes a nice overall. It's like washing and waxing a car. It's the same car, it just looks better. That's the same thing with filler. It's the same person, the same anatomy, but once we fill it, it tends to look better. Looks refresh the area. And sometimes there's a little bit of pinpoint bleeding, but it's nothing dangerous. Just for the little needle injection. How you doing, Lois? Comfortable?
Yes.
Okay.
Mm-hmm.
going to put you to work here, and I'm going to have you hold this gauze on the left side of your lip. There you go. Perfect. And then go to the other side. Lois does not have a lot of lines, which is nice. She has a few. Tonight, she'll be able to use regular old soap and water, regular old moisturizer, and then tomorrow she can use a little cover-up if need be. There is some bruising and swelling after filler, especially around the mouth. Ice helps, so she will get a little ice pack to put on here immediately when we get done. Bruising and swelling is usually a couple of days. Although there may be some noticeability that there's been a process of injection beyond 2 days. Everybody's a little different. Women have the advantage of having a magical product called makeup. And they can hide a world of sins with makeup, so I'm told. That was a joke. If we had a live audience, they would be laughing. There we go. How you doing? We're almost done, actually. Topical anesthetic worked very well for you today.
Mm-hmm.
Sometimes we use a topical anesthetic, which is a product that is applied over the area that we're going to inject about a half hour before we do it. Or more commonly, we do what we call a nerve block, where we do a little injection with the little nerve branches around the area, and that numbs the area as well. But it's different. It also depends on what I'm doing. A small localized area like this does very well with the topical anesthetic. And these areas are overcorrected by about 20%. Because there's a certain amount of fluid in here, and that gets absorbed and becomes more perfect correction. Okay, we're going to have you hold this side. Just about done. Now look at the left side here. And you wash that off. That side's the done side. You basically did 3 lines. 1, 2, 3. Look pretty good. Okay, left hand there, Lois. I'll wipe this side off here. And we're all done. That's it. All right?
Mm-hmm.
That's it. Straightforward, simple, and easy. A nice way to treat the little vertical lip lines around the mouth.